So our first speaker of the night is Dr. Lewis. He is the professor and chair of the Department of Anesthesiology and Perioperative Medicine at RWJMS and chief of anesthesiology and director of perioperative quality and safety of RWJUH. He's also the vice dean and is a valuable participant in the development of the school's strategic plan. Dr. Lewis is very loved by the RWJ community, especially by the M1s who had the pleasure of attending his captivating and inspirational talk during orientation. With that said, I would like to invite Dr. Keith Lewis here as our first speaker.
Thanks for the kind comments, and I'm very excited to be here. It's a little bit harder to see you than I could 10 seconds ago, but welcome. Very excited about this, and I hope that I can impart some lessons to all of you this evening that will be helpful. And so my talk, and you're probably wondering, what an unusual talk for an anesthesiologist. Curiosity and kindness builds trust. So think about that for a minute. And thank you for the interesting comments, because you used the word of being curious. So Dr. Weber already said, where did TED Talks come from? So you're starting to see someone who has an MBA, who was curious, who started to think about it, started to think about a different lens to look through things, and shows the first thing they want to talk about. So I ask all of you, did you notice what I did when I walked in the room just now? Where did I go? And did you notice anything that you're curious about in the moment, based on my little journey in the last 25 seconds? She likes the sweater. Say it again?
What's in the bag?
There's the bag. So notice the bag's outside of my zone that I can walk. So I've been warned, don't cross the white line. So I promise that I won't, but I'm going to come really close. But anybody curious what's in the bag? Go ahead. What she thinks in the bag?
I don't know. Maybe you could be giving out prizes. That's what I thought.
It's a good thought. Do you think it's something kind? Do you think it's something, a gift or something?
Yeah, that's what I think so.
Could be. Do you believe that? Do you trust me that it's really in there? So I guess as we start out and you look over, maybe there's nothing in the bag. But since I started out, I wore a sweater that's kind of got a teddy bear on it. It's cozy. I didn't wear what you'd expect the vice dean to wear. I wore sneakers, and the students looked at me and said, look at what you're wearing. I guess we could have dressed down. I looked and said, I was afraid to dress up because I wanted to make sure that you felt comfortable with me. So I'm trying to be approachable. And I look here and say, where am I going to go with this? I'm going to tell you what I'm not proud of first. So this is supposed to be a journey. It's supposed to be a story in the next 15 minutes. So I'm not proud of the following, that I got a full scholarship to play golf professionally. And I got it at Wake Forest, and the full ride, my entire kind of, activity during high school was get better, win, don't lose, get another hole in one, be better. So I was relentless in my pursuit of excellence, and I practiced all the time, and every minute I had, I did something. If I went to the beach, I brought a golf club to practice in the sand. I put the ball in the water. I tried to hit the chimney on the house, and I did, and I broke the window. So I think that I tried so hard to get better and better, and I got good enough that someone actually recognized that I was really good at it and said, you're going to be playing on TV, and you can be watched on the Sony Open last weekend. So then I got nervous. And fear, is something that gets you in trouble because it kind of paralyzes you, as opposed to doing something which results in an outcome that's positive. So I got nervous that would I be that good and could I achieve my goals? So I got anxious and I changed, and I decided to go to pharmacy school. That was the first mistake. The second mistake I made that was really a big one, not going to pharmacy school, because I was still so competitive. So I'm in a pharmacy class, and I'm just like, I have to do well. I have to prove myself. So I got 4.0. I never got anything less than that, and I won every award at graduation. I'm so embarrassed that I'm telling you, because part of my healing process. Then the one award that I didn't win was a tie, and it was with Carolyn Krell, and we had a test off, and I won the award. And I went, yes. And to this day, I'm still embarrassed. Because it's not about winning. And I guess my message that we started about curiosity and how I get to the next part was that I won. I got the 4.0. I got all the scholarships. I got the best residency in hospital pharmacy at Yale to work in the cancer clinic with a Dr. Bertino, who was an amazing MD, PhD scientist, who was curious and was everything. And I ended up in the laminar flow hood drawing up chemotherapy drugs because it was dangerous. And I was trying to create a new concept, which was a research pharmacist that actually took care of the medications. I was so bored in that room. And no one knew that I got a 4.0, and no one knew that I won all the scholarships and all the awards, and no one cared. Other than my friend that finished 425th in the class, who was my friend, because he said, the only reason I finished is because of you, and the only reason that I'm going to go to medical school is because of you. And he says, but my diploma doesn't look any different than yours. It doesn't have a number on it. So look at what happened. You wasted all that time being really smart, and I had fun. So he went to medical school, and I even took the MCATs because of him to try to help him, and I never used the scores. So then, I was there, and I roamed out, and I started talking to patients. And I got really curious, like, what's in that bag? And what's that drug? And why is it red? And why do you vomit? And why do you not vomit? And why do you do well? And why does that provider seem to have better outcomes than that one and have the same patient population? So my curiosity got to me. And someone said, you got to get out of that room. I'm like, no kidding. And they said, because you're curious and you're not going to do well in there. Whatever you did in pharmacy school didn't help you. So then I became kind of different. I became less competitive, more curious, more interested in other people than myself. And I was much happier because I was miserable in pharmacy school, spending all that time sitting there memorizing all those drug things. And I still remember them, which is even more pathetic. So from my perspective, what I learned was get out of that room, which I did. And then someone told me to go to medical school. And I told this at the first year thing. And I did. And I looked. And thank God I took the MCATs because then I could use the score to go because I had no intention of going. So my interest in medical school was by default of just, I want to get out and I want to do something. I want to make a difference. So why is curiosity important? Because it's like it just keeps you going. And maybe it's the anesthesia thing. It's like a drug that just keeps you moving in the right direction. So I continue to be curious. And Einstein even said, I'm really not that smart. I'm just really curious. And he just kept looking at what's in that bag. So you're getting more and more curious about what's in the bag. It better be good, because then you'll be disappointed if it's not. It's not that good, but it is interesting. And I think it's really powerful. So the other part, I'm making even more curious because I keep adding facts about it. And you don't scratch it off and those kind of things. So I'm not going to tell you what it is, but I'm going to make you more curious. So to me, curiosity is something that if a medical student has it, it is a gift. So if any of you are curious, you have the perfect recipe, because being the most competitive, getting the best test score, getting everything best may be critical to your next step, but it's not going to sustain you for the rest of your life. I have not lost my curiosity. And I've been doing this for a long time. And if you went into my office, you'd have to look really hard to find the anesthesia book. There's one of them. And there's 150 other books on every topic you can ever imagine. And I have been as interested in every one of the books as I read it as anything else. And they're on every topic across the board. So I think my first comment to you is curiosity is something that is really critical to your long-term survival and well-being, and it will make you happy. And when you're happy, you do better in that particular scenario. So how do we get then to the kindness part? So then I noticed that the providers in that clinic that took care of people that were kind to their patient. And what is kind? It's not good morning, how are you, a smile. That's being nice to people. So nice is kind of a gesture. And people say nice and kind are the same thing. Kindness is an action. So kindness is actually doing something and not just smiling or a handshake or whatever it may be. It can be helping with an elevator door. That's kind of an action. But I'm talking about deep kindness. That what does it really look like, to be really kind? And think about it. Say to yourself now, are you a kind person? What do I mean for that? What I mean by that? I mean that you're willing to give something to someone else expecting nothing in return. And being so happy when that other person in that situation responds and you notice that there was a change in a smile or an action or whatever it may be. So what does it look like? It looks like something where, you go to a room and a patient's had a stroke, and we're talking about what Dr. Weber talked about, is that we reflect, that just remember, we are all people, but someday, every one of you will be a patient. And you better hope that when you're a patient, that the person who is treating you is going to be compassionate and kind to you in that interaction. Because it's going to make a difference, because we know that people that treat people with curiosity and with kindness that the patient likes you better in that situation. So what came out this week before I did this talk? My ASA Society sent out a thing of the old guy in room 606. And I thought, that's me. They're talking about me. How did they figure my story out? So I look and I read the story, and it was about a guy with Parkinson's who'd gone to law school, who had a large family, who started out with nothing, who did all this stuff, but kept falling and breaking bones, and was rigid and had horrible pain. It was just really suffering. So the son came out and said to the nurse on the floor, that my dad, in the room is really having a hard time. Could we get him something for his pain? He can't fall asleep. And the nurse said, oh, that's the guy in 606, right? And he goes, yeah, it's the guy in 606. And he heard her say to the nurse, the guy in 606 needs some pain med. So then the nurse came in, for the guy in 606 without a name. And there's always an adjective before, age, and there's always a comment, the person in room 606. And the nurse suddenly stopped and paused and kind of looked into his eyes, and at that moment saw this human being could have been her dad, and saw the family there just looking at this poor guy who was not the guy that can't move, that keeps falling, all the things we diagnose him with, but the person who has lived an entire amazing life, who's brought up an incredible family, and she saw him as that person. And she wanted to help him with that family who was all feeling his pain, allow him to go to a better place. So she gave him the medicine, and he fell asleep, and she stayed there, and she rubbed his hand and said that what was gonna happen, and she sat there with him. What happened during COVID? Because we stopped this for COVID. So I'll tell a story about that. That in Brazil, they had a lot of patients that had COVID, and they didn't have all the ventilators that we had. They didn't start with them. For 20 hours, they only have 3 anesthesia machines. So it means a lot of people get anesthesia up to the neck with a spinal without general anesthesia, which works pretty well, actually. So you look there, and what did the nurse do? The nurse had all these pulse oximeters going off, and they couldn't prone everybody and flip everybody and intubate everybody and give them the monoclonal antibodies we had in the United States. So the nurse was like absolutely having a hard time coping with, I'm not helping these people because their pulse oximeters are either falling off or they're diving, and I need to keep their hands warmer, and they're on those vasoactive drugs. So she decided to take the latex gloves and fill them with warm water. And she put the water in and put it on the bottom and the top of their hand and wrapped it in a towel. And guess what? The pulse oximeters worked. And her anxiety went down so she could be more compassionate and empathetic and kinder to her patients, not worrying about someone would die under her watch, which was her worst fear. So then they woke up, and someone said to one of the patients one day, so it must have been really scary to be prone and turn and have COVID and not knowing you got to live or die. And the patient said, not at all. And they said, why not? Because the nurse held my hand the whole time that I was in the ICU. That's what kindness is. That's like doing something. I had a patient that I saw, at Robert Wood in the MEB, and was in a wheelchair. And it was the day that I was getting the Rutgers Kindness Award, which I didn't want to go to because I don't like the recognition thing. I've gone in reverse of the level 5, leadership. I don't want to be the one recognized. Everybody else deserves the award, not for me giving out kind bars or being interested. So I was delaying to be late purposely in my mind. And I was, and I knew it. My assistant's like, you got to get in the car. You got to be there on time, and they're going to take a picture. And it's like, I don't want a picture. I just want to get the award so we can all tell the department, and we're excited. So I eventually showed up. There was a guy that went into the men's room who was in a wheelchair, who was really struggling. And I was so embarrassed for us as a hospital in a building that the door was not handicap accessible, and everything was wrong. And I kind of delayed, and the guy, when he turned, I noticed had, and Dr. Sun will appreciate this, but had some kind of decompressive, craniectomy where he was kind of missing the whole right side of his head. So I paused for a moment, and then I delayed, and I washed my hands 14 times. And I finally said to him, can I help you? Because I realized everything was wrong. The urinal was at the wrong height. Then he was got to go to the faucet, and it's too far away. So I helped him. And I stood there, and I said, I'm going to wait a minute. You need to leave. And my secretary is still out there yelling, where are you? What are you doing in there? And then I stood there, and I said, I'm going to help you out to get the paper towel, because once again, it was too high. And I did. And he said to me, thanks, dude. And I said, thank you for coming to our hospital, because I'm like, and I'm sorry for this, and I'm going to make sure we make a difference moving forward. And so then he looked at me and he said, before you leave, can I tell you something? And I said, what? He goes, most people would have ran out into the hallway and said, go in there and look at the freak in the bathroom that's missing half his head. And he said, but what you did was you didn't think that. You looked at me as a human being. And you were respectful of me as a person and didn't look at me. And I want to thank you for that. So I look and say, another really good example of, I think, what kindness is. And it was gutsy for me to stand in there and kind of linger and kind of impose myself on trying to help. But I was not afraid of doing that because I knew it was the right thing to do for him. I still see him, and every time I see him, he gives me thumbs up in that scenario. So I look to say, whether it's the stroke patient who can't move the right side, who's homeless, whose glasses are on crooked, who are dirty. I saw a nurse take the glasses off and clean the glasses. And he's like, but I didn't ask you to do that. She goes, but I knew that you needed to have them clean. So I look at every one of you, I challenge every one of you right now to starting, today, not tomorrow, because kindness is free. It's like a drug that has no maximal dose, not like those chemotherapy drugs that I used to use in the clinic where the dose you give to either treat the tumor or to die is almost the same dose. It's like a 0.1 millimeter away. So in that scenario, so that's one thing to worry about. But I look here and say, start now. The dose is unlimited. It doesn't cost anything. The refills are unlimited. It's really easy. It's hard to make mistakes with it. So just do something. Pause. If someone's struggling with their change, give it to them at the Starbucks and help them out. If someone needs something, like just be there for them without judgment and other stuff. So I ask you all, as part of my challenge to you today, as part of this, is be kind to other people and don't start tomorrow, start today. So that's the next part. So then you get into, what's this whole thing about trust? I tell you that to get to trust, that if your patient has you not referred to them as the patient in 606 or Molly in room 14, whatever it may be, is that you need to do things and use adjectives to describe them. That Molly, true story in New England Journal, a 6-year-old girl with a brain tumor with ALL and a third tumor who was dying, that the nurse found out that she liked to have parties with pedicures with her friends. So they set up a pedicure station on the floor when she was intubated and dying. And all the nurses on that floor painted their fingernails. And they painted Molly's. And Mom came in and thought something horrible was happening because there were so many people in the room. But they were celebrating Molly that was energetic and fun, and this was her favorite thing to do. The mom's comment after Molly died was that no drug, no treatment, nothing out there saved my daughter, and nothing could save my daughter in this particular year. But what saved me and what saved my family was what they did to know and understand her and to celebrate her and to do something that was for her. And there's no code for polishing fingernails or doing pedicure and manicure, but that stuff is what I think about today, with the respect and dignity they treated my daughter with before she died. That's kindness. So when you're courteous to someone and you're curious to someone and you're kind to someone, they're going to trust you. So the reality is, if you want better compliance, better show-ups, better follow-ups, your patients to be better as far as outcomes and length of stay, if you treat them well with kindness and curiosity and learn something about them, it's going to happen. So that's the reality of that part. So now we're getting closer to the bag. So in this scenario, my whole point here is that, and the thing I do like, and I do like this one, I like the grades and I like the other stuff, is that I wrote a book that before I left Boston. And the reason why I wrote the book is not because I wanted to write a book, is because I wanted to make a difference. And I'll tell you about the book and how it all fits into curiosity, followed by kindness, followed by trust. Is that the book is written about a 6-year-old kid who was at my hospital, who one night when I was at the hospital gala raising money for a hospital, got a phone call at 2:12 a.m. in the morning. And the phone call was one of my anesthesia providers, like something really awful just happened. Not the phone call you like to get his chair. And I said, what happened? They said, there's a 7-year-old child in room X, and that child had an appendectomy 4 days ago, was perforated with septic, has an ileus, and got put on parenteral nutrition, and they died. That they arrested, and I went to the code, and it's one of my intensivists, and we did everything we could, and we could not resuscitate the child. That's an unusual story. So, my curiosity kicked in, like sequester the bags in the room. What drugs do they get? Let's look at the cameras. Don't take any of the pumps out of the room. So I went into my kind of medical mode of curiosity of what happened. Like we need to know everything, what antibiotic, call the pharmacy, check the record, look in the Pyxis, look in the trash, look in the needle bin, all the things that anesthesiologists do to figure out what went wrong. So that was phase one. The next part was we have to tell the family because we figured out what happened. We realized that we often did not give parenteral nutrition to 7-year-olds. We gave them to adults, and neonates. So the pharmacist went in and prepared it, and during that time period, they gave 10 times the dose of potassium. That's not resuscitatable, unless you're in a heart room and you know what it is. We didn't know what it was. No one would have ever thought that in that scenario. Now, I have to, because I look here and say, I'm a pharmacist. The pharmacist involved in that case was so devastated, she couldn't even come to work because she realized that she did override. And the child died, and she felt personally responsible. So I went to her out of my act of kindness, because this is the worst nightmare for anybody, and talked to her, and they wanted her to explain to the family what happened. And I was like, no. She is the second victim. This is not a good thing. This is not good timing for her. She has 3 little kids. I will talk to the family. And I did, and it was the worst day I ever had, because the mom was there. She had 3 little kids, all younger than this kid, plus the rabbi in the room. And she said, you're the one that did it? And I'm like, no, I'm not, but I'm part of the hospital, and I'm here to tell you because we own this, and we are so sorry of what happened, and here's what happened. And she was so angry, and it got so personal, and it was so directed. And I just sat there and said, I'm sorry. And we all cried together. It was the worst moment. And I left the room, and they said, you were courageous to do it. But my comment was, I was the right thing to do, and it's what we need to do as a hospital, say, I am so sorry. So how do we get to that? So that's the kindness part, even when it's not easy. And that was not an easy kindness for me to do. But then the next part was, what do we got to do to heal? Close the pharmacist and myself. We're going to write a book, and everything we do here, we're going to get better, and we're not going to let Rafael Mira's death temper our enthusiasm in doing what's best, and we're going to have an unwavering commitment to patient safety. So we wrote 52 chapters, and almost every chapter has a medical student in it. So we engaged our medical students, and the whole book is all written about, is it okay to proceed? And what that means, are you prepared enough for the complexity of this case to cross this line? I'm going to get back, Bill. So when you cross that line, that means that I'm not prepared, because I'm supposed to stand in this space, and I listen with genuine listening in this scenario. So as you look at this here, what happened was, we then, 10 years later, when we prepared the book and finished it, we dedicated it to the mother. Think about that. Every year we had a lecture with the mom and the kids, and every year they got bigger. And every year I had to stand and introduce this talk on patient safety, how we were going to change things. And we did. And that year, we dedicated the book to the mother. So we went in a full kind of, 360 of what happened and came back and did this. And she came up and she hugged me and she said to us, I commend you on your courage and your commitment to never let this happen again. And she goes, but this is not the worst thing that ever happened. And I want to tell you alone, because I've told no one else. And she came up and we went in a room and she told me, when I was pregnant with Raphael, I had a brain tumor. And I was told that either it was me or the child, and it couldn't be both. And if I pushed the brain tumor too far with the child's maturation to be someone that would live a normal, sustainable life, that I would probably die doing it. And I was willing to do that. And I got far enough along, we had the baby, and then I had my brain operation, and I'm cured with the brain operation, and I had the child. The part of the story that she didn't plan for was Raphael dying. And she said, it was the hardest thing that ever happened in my whole life. But now I look and say, we together have really pushed this book all over the place to be safe and do what we need to do. So that's the first part of the story. The conclusion here is, I'm not done with pushing on this either, is be curious, be kind, do trust. And then now, of course, I just don't have kindness bar. I've gotten bigger in the concept here, and I'm still pushing. And we celebrated Kindness Day at Rutgers. The ASA Society this year is celebrating World Kindness Day. We've created all these things. So this little thing I started talking about a year and a half ago has gone wild, where it's hard to argue of why you should not celebrate World Kindness Day in healthcare, why we shouldn't be kind to each other and to our patients. So on this scenario, if you look here, it created a kindness score. And what is the score for? It's like an APGAR score. Vivian Apgar started the APGAR score in 1952. She wrote it on a napkin. I wrote it on a napkin. I'm trying to follow in her footsteps on this one. So what is it all about? It means when you go see a patient, let's say this is a surgeon, so this is Dr. Sun. I'm going to score him, and I'm going to tell him in advance how he gets scored. If he shows up late, never happens with a surgeon, he gets 0 points. If he shows up on time, meaning on time, not like, how's it going? I'm here. I'm going to go in the room at 7:29, in the case 7:30, but like 6:45. How are you? You're nervous? I'm about to open your head and take your skull apart and take a brain tumor out. Why would anybody be nervous about that? Do I really listen? Yes, I am nervous. You'll be fine. Don't worry. I'm the best surgeon in the world. So you rate them. Eye contact. Oh, don't worry. When everything's great. Good to see you. Good to see you. It's been great to see you. No, I want the look right in the face, sitting straight there, looking at you, is you're going to be okay. Like I say to the trauma patient before they go to the recovery room that's been shot and has a blood pressure of 60, I will see you when you wake up in the recovery room. There's nothing more I want someone to remember than my final words and not my dose of Versed. Why should I give a drug that causes amnesia when I can say something they'll remember that has a positive impact? And then be positive. Today's going to be a tough day. It was a long weekend. And are you attentive to their needs? So if you do all those things really well, you get a 10. So from my perspective, here, I'm going to play this APGAR score out, but it's going to be a Kinder score, and people can self-grade themselves saying, we think you should be on time, we think you should have a general listening, good eye contact, be positive, and be attentive to the needs of your patient who's putting their life in your hands, wherever that may be. So then you look, that's the book, it has a barcode, everybody likes that, you could scan it. We were way ahead of people because every chapter has 2 videos and animations, and no one did it, we did it, because I know you don't like to do long things, so no one's got to read the book. But if you want to watch all 104 animations, they're all 90-second each, so you can do the whole book in 4 hours. So, what's in here? Now you know what's in here. You can see where I'm going with this. So I'm going to leave this here for all of you. It's got copies of my book. It's got kind bars. It's got be kind pins. In a world where you can do anything, be kind. Everyone you meet is fighting a battle you know nothing about. And I think that's probably the most important. Be kind. And those 2 books are all about what's the wonder drug? It's kindness. So it's been talked about, compassion and being empathetic. What's compassionomics? We know that patients that are treated with respect, with compassion and kindness have better outcomes. It doesn't take a drug. It just takes a look, a moment, and attention. So I'm going to leave, and here's my deal with you guys. I only have 3 copies of each book. And I have a bunch of pins and a bunch of kind bars. And that what you need to do is whoever's really curious and wants to read the book should take it. So you guys have to decide among yourself. But then when you read it, because you're the curious one, I know you're going to get so excited about it, I want you to give the book to someone else. And I'd like to see this book and this concept and this movement go. So I'm going to leave them here at your discretion because you're not competitive, because we've talked about how that can be bad, and how you're collaborative and how you're cooperative. And you're going to either decide who you think should get one, not the kind bar, but the other part, because using a kind bar with the wrong person can be very dangerous. But come down and get it during the intermission. And I thank you. And all I ask from all of you today is to be kind to the person next to you and someone else, and especially the patients, because eventually all of us will be one. So thanks for your time.